Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valance, and we're taking your calls all hour at 866-870-5752 right here in the studio, 866-870-5752. Check out the website at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. We are here Saturdays at 10 a.m., again at 1 p.m. And right now we are speaking with Howard. And did you want to say something before we go back to Howard?
Howard, I think we finished up with you, didn't we? We had we talked about your shoulder and your foot. Is there any other question you have?
Okay.
Howard went bye-bye.
Howard
okay.
is gone. All right.
Before I get to Mimi, hi Mimi, Dr. Marc Darrow, I want to just talk a bit about other things we do in the office that are related to regenerative medicine of the musculoskeletal system. I've been doing platelets and stem cells for many, many years. I've been told I do more than anybody else on the planet, so I'm pretty busy. And it's interesting, you know, we have a website which is www.lastemcells.com. I'll repeat it, www.lastemcells.com. I get, every page has a spot to email me, and I get emails every day, all night long from all over the world. And guess what? I answer all of them. First thing I do when I wake up, I pop out of bed, I go to my computer, I do emails between patients, and I'm usually up to about 12 or 1 answering emails for people. So that's another way to get a hold of me. The best way is right now, call me live and talk to me, 866-870-5752. Or you can catch me at the office or get more information from my staff at 800-300-9300, 800-300-9300. And I wanted to talk about something about regenerating the face. Now that sounds weird, but we can use platelets or stem cells or both to inject into the face. You get a few injections with a tiny needle, and the collagen on the face starts to grow back. And people usually start looking better by the next day. And it rejuvenates, makes people look great. It's called, believe it or not, the vampire facelift, because we're using blood. So it's a catchy name, the vampire facelift, make you look good again. As we get older, the collagen in our body dries up, not just in the joints, ligaments, tendons, neck, back, whatever, but also in the face. And then on the hair, we can put this into the hair, platelets or platelets and stem cells, and rejuvenate the hair. So it's not going to work on someone like Dr. Phil, who's got nothing going. We'd grow some, but it wouldn't. Yeah, it would grow a little bit, but it wouldn't really satisfy him. But it's great for people that still have some hair on their head and they're just thinning. And I did a young man yesterday, 27 years old. Interesting case, strong family history of hair loss, what we call male pattern baldness. And his labs were drawn. He had a high dihydrotestosterone, which actually kills the follicles. And the doctor that he was seeing put him on something called dutasteride, also another name is Avodart, and it blocks DHT. So I had him get a bone density, which is typically done for women as they lose their periods and they get osteoporosis. Guess what this kid had, 27 years old?
Osteoporosis.
Yep. And he's the third one I've found, young men losing their hair. So we have to be very careful. If you're taking Avodart or dutasteride or Propecia or finasteride, all of these medicines are 5-alpha reductase inhibitors, which blocks the conversion of testosterone to DHT, dihydrotestosterone, which we need for our bone remodeling and bone density. So be very careful if you're taking these medicines because you think you're going to save your hair. I think you'd rather save your bones. The other thing these medicines do is they cause impotence because you lose the firing mechanism for erections. So be very careful when you take medicines of any kind and look for the side effects. This is a terrible side effect because we know that if someone breaks their hip from osteoporosis or really any other cause, but it's most often osteoporosis, there is a 30% chance they will die. You don't hear doctors talk about that. And these medicines that are supposed to save your bones, they don't work. They block the remodeling of bone, and then you end up on the bone density. It looks great, but it's weak bone. And we know that people that are taking these medicines like Fosamax, and there's a lot of other ones, end up with jaw fractures. The dentist, as they're drilling or whatever they're doing, the jaw falls apart where the tooth is. And then they have what are called proximal femur fractures. That's the part of the thigh bone closest to your body. So be careful. Watch out for medication. I try to get people off of medications and do things naturally. Okay? All right, let's go to Mimi. She's been waiting. Upper arm and the joint.
Dr. Darrow?
Yes, Mimi. How are you?
Hi, how are you?
I'm living it up.
Yeah, I'm not right now. Anyway, so I took X-ray at Kaiser, and they found out the X-ray shows that I have pretty bad degenerative joint disease.
Okay.
And it says wear and tear arthritis of my neck, along with muscle spasm.
Okay.
And then there is enough degenerative joint disease that is probably pinching on my nerve and causing symptoms.
Okay, what is the symptom?
What do you think? And all they ask me to do, exercise, like, going on the walk 10 times and then the stick,
Mimi, we're all laying here with bated breath. What are your symptoms?
My symptoms is I have the right arm. The right arm is not good. Every time I move, it's like it's giving me spasm.
Okay, so you have pain in your right arm, probably coming from your shoulder joint, which is arthritic.
Yes. Well, they say I have arthritis on my.
That's what they say.
That's what they say. Arthritis of my neck, along with muscle spasm.
I gotcha. So, can you lift your arm up?
I do, I do a little bit, way up, but when I bring it down, I feel the pain.
Okay, that's good. I understand. Can I speak for a while?
Sure.
Okay. So, having arthritis is not necessarily a big deal. It's a terrible word. Arth means joint and itis means inflammation. So I have a lot of people that I treat that have arthritis all over their body, from the neck all the way down to the toes, and often we can get them better. But the first thing I need to do is examine you and see what's going on. I don't care what an X-ray or an MRI says, okay? I care what your body tells me and what my hands show me when I touch it and examine it. So if you're interested, you can call my office right now at 800-300-9300. I'll repeat it for you while you write it down. 800-300-9300. And you can talk to someone, come in, and in about 1 minute, I can tell you whether I can help you using regenerative medicine of stem cells and or platelets. Okay? Just because you have arthritis doesn't mean anything. Okay?
Okay, doctor. Do you think the stem cell is okay for me to use?
Well, I don't have an answer because I don't know if you need it. I have to examine you first.
All
All right, Mimi, God bless you.
Okay,
Thank you, Mimi. Thank you. We appreciate your call. Our number is 866-870-5752. Right here in the studio, you can talk directly with Dr. Darrow and ask him your pain problems. And check out the website at www.lastemcells.com. And we have Alex in Los Angeles.
Before we get to Alex, I just want to show the camera this book that I wrote called Stem Cell and Platelet Therapy with the byline Regenerate, Don't Operate. You call me right now, I'll send you a free copy of it. It's a big book. It's got a lot of information. It's all studies. It shows why surgery is not a great thing for you in terms of musculoskeletal complaints, and why regenerative medicine using injections of your own cells from your own body can heal you. And if it's for me, I don't want a knife in me. I'd rather just inject myself, which I've done on both my knees, both my elbows, my right wrist, both my shoulders. Every time I've done it, I've had success, and I beat myself up pretty darn good doing sports. I'm 73, and I expect I will be doing sports until they throw me in the ocean.
All right.
That's the Neptune Society.
Well, okay, but I want to also add that book has 264 studies, scientific studies. You can get it by calling the show right now at 866-870-5752.
Did I mention it's free?
Yes. Did I say it's free?
Alex,
Yeah, free.
Dr. Marc Darrow, your hip joint bothers you. How long has that been going on for?
How are you, doctor? Thank you for taking
I'm
the
living
call.
it up. Thank you so much for calling and being patient and waiting.
Well, yeah, absolutely. I mean, it started for a number of years. I had lower back issues, and it wasn't really very bad. It was okay coming in and out. I had dislocated disc. It was put back in, and the back has never been like perfect, but it was okay. So then it started bothering me in the sciatica, which I thought was all sciatica. And probably within the past 12 months, every now and then the pain became kind of sometimes a sharp pain when I turn the right foot a certain way. If I turn it in or I turn it out, it kind of hurts. And sometimes I limp, so I couldn't jog anymore the way I used to. I couldn't exercise or maybe even play tennis. So I decided to go for a doctor's visit. And about a month ago, I went to the specialist in Los Angeles, at the orthopedic specialist, and they did an X-ray. I said I would like to get an MRI, so they did an X-ray first. They asked me we need to do an X-ray,
Sure.
see what else might be bothering you here in the right leg, right hip area. And it came out, and he immediately said, "Well, you have an arthritis, and you have occasionally bone on bone. That's what's causing sharp pain, and so we need to operate, do the hip surgery." They brought out the model, as you've seen many times,
Sure.
the joint model. And just like that, within like 2 minutes, he says, "Okay, we need to operate."
Yeah.
I just kind of didn't like that approach. It was too robotic, too inhumane, too fast. I only have one body. So I don't have
Yes.
to play
Yes.
to replace, and that approach was not good. So I got a second opinion like about 5 days ago over in Encino, and that was a different doctor. She was nicer, softer, and she basically said, "You have a moderate." They also had me do an X-ray, which was a bigger X-ray because they surveyed the whole pelvis area.
Okay.
And he says, "You do have some misalignments with your lower back, nothing critical, but your hip, you have a moderate arthritis in your joint."
Okay. What kind
And
of
that's
doctor was the second one? Was it also an orthopedic surgeon or a chiropractor?
Absolutely. It was a specialist who only does knees and hips. I requested
So orthopedic surgeon?
Correct. Orthopedic surgeon.
Okay.
So
Good.
he says, you have this issue. But he said, "I'd like to send you to physical therapist first. Let's see if we can make some improvements that way for the next 3 months." And also
smart.
prescribe anti-inflammatory. He said, "After 3 months, depending on how you feel, we will then talk about possible surgery." So he was
Okay.
softer on me.
Yes.
And that's how I came to you. And in fact, I listened to your program before, and I really appreciate because it sort of opened my eyes probably for a lot of people too. And for the first time, I heard the word regenerative measures. And so with the second doctor, I asked him about that. And then his response was that, well, yeah, people are talking, but we do not have a scientific proof really that it works.
Okay.
These are his words, quote unquote.
Okay.
And I was not up to arguing with him at that point. I simply said, "Thank you, doctor. So I'll do what you told me to do. I'll do anti-inflammatory and 3 months of physical therapy, and then we will re-engage."
Okay.
That's where we are today.
Let me speak for a moment, okay, Alex? I got a lot to say from everything you've told me. Number one, I used to have an orthopedic surgeon in my office. He was in my office for about 8 years. And he used to refer me about 15 patients a month for regenerative medicine. And most of them got better, not everybody. Most of them got better from what I did. And I would talk to him all the time. We were like best friends. And I go, "Don't you think it's kind of amazing how regenerative medicine works?" And he goes, "No, it doesn't work. It's placebo." Okay? That's number one. So that's like religion. How many religions are there? 10,000 of them, and they're all the only one? You know what I mean?
Lots of them, right.
You know, if you're in a certain religion, it's the only one. And so
that's correct.
there's different schools of medicine. So that's number one. When they say there's no science, there is so much science on this stuff. It's been around forever. Okay? I've done science in my office. We do research in our office. We had 25 people doing research on all of our patients. We've published this stuff. I still have a lot of friends who are orthopedic surgeons. They do not believe this. And they also say, "Well, I've done it a few times on patients and it didn't work." And I go, "How many times did you do it on a patient?" "Well, I did it once and it didn't work." It doesn't work like that. The example I use, it's kind of crass, but I say when you have a hole in the ground and you need to fill it up with dirt, how many shovelfuls does it take? Will one shovelful do it? Maybe if it's a small hole, but if it's a big one, it takes more. And, if you're trained in surgery, it's a cult. Everything we do, regenerative medicine is a cult. They're things that we believe in. When I was doing orthopedic surgery in my training, I believed in it until I had one on my shoulder that jacked up my shoulder terribly. And then I was able to heal it when I learned about regenerative medicine. I don't know if you listened to the first part of the show. I injected my right shoulder one time after a terribly failed surgery, which lasted miserably for 4 years, and it healed overnight. Okay? That was a wake-up call for me. That was like God came and kissed me on the forehead and said, "You're going to be doing regenerative medicine." And it's basically all I do now. I've been doing it for over 20 years. I get about 60, 80 new patients a month, and most of them are pretty happy with me. Not all of them. Okay? You can look at Yelp if you want to. Yelp.com. It's a review. You're going to see some mostly wonderful reviews and a few terrible ones. And the terrible ones are generally for the reasons that I mentioned before. People do this, they quit too soon, they're too active, they are taking anti-inflammatories which block healing. There's a lot of reasons why people don't heal. Okay? So I understand the surgical point of view because I was there. I understand it. But I get people with a lot of arthritis every day that we heal, okay? And we don't do it surgically. And then I get a lot of people who come in after surgery where it made them worse. So what do you think I think? I gain my opinion from what I see happening. And what I see happening is that surgery is generally not a great thing to do. It works in some cases. And then some of those people that were my patients, and I said, "Don't get surgery," and they go and do it, and then they call me up and say, "The surgery worked," and I go, "Great, I'm really happy for you." Then they come back 2 years later and they go, "Whoa, it's even worse now. I guess that surgery didn't work." And then they come in and treat with what I do, using regenerative medicine of PRP, platelets, and stem cells. So, no one has all the answers. I don't have all the answers. But I do know this. If you're going to treat for some medical condition, do the most conservative thing you can first, not the most invasive thing you can. Does that make sense?
Yeah, it sure does. It sure does. So, the first doctor would not even give me any options. It was, again, like I said, very robotic and cold response, so we got
Yeah, I get it. The orthopedic surgical mentality is a certain culture of medicine.
Yeah.
I don't put them down. They're great guys, and they do hard work, and they have a lot of terrible side effects, so they have a lot on their mind. But it doesn't mean because they're strong-willed people, and the hospitals can't survive without orthopedic surgery. I don't know if you know about that. Financially, financially,
I'm 56. I'm pretty healthy otherwise, and I do try to take care of my body. I'm not overweight. I'm exercising now, a little bit less because of this kind of a hip issue. But again, the second doctor was a little softer, a little nicer, and he says, "I'll give you. Let's look at it 3 months, and then we'll revisit."
Well, you always want to be conservative, so I take my hat off to that second doctor that you saw, and the first one. I don't know what to say. Everybody understands that that's not the guy they want to go see because there's one answer from him.
For all of you listeners out there, listen to Dr. Darrow and take notes.
I don't know about that. You know what I always tell patients when they come in?
Information and to be able to make an intelligent decision when it comes to your body. Don't rush into any radical solutions instantly. Because people get scared. Sometimes pain makes them go into something that they wouldn't normally, do. But
so Alex, we love you very much for calling in. You had a lot of good information. We do want to get to James because the show is closing down soon. So James, God bless you, man, for calling in. Thank you so much. I understand you have a knee issue. What happened to your knee and how long ago?
Yeah, I had, years back with football, I had torn the ligament. Every once in a while, when you bend down enough, you'll get like a knot behind your knee. What is that? What causes that?
One of many, many, many things. One is you may have a Baker's cyst, a popliteal cyst, and that's something that we can aspirate under ultrasound so we can get every drop of fluid out of there. And then the tendons on the back of the hamstrings insert at the side of the knees. It could be that. There's just so many things I can't even tell you what it is. If I touch the area, I can tell you in 1 second what it is. But just talking about it on the radio doesn't really help us figure out what's going on with you. So if you want to come in, the office number is 800-300-9300. You can call there right now. There's people by the phones. That's 800-300-9300. And I'd love to see you and find out what's going on.
Okay, also when I stop in, I heard you talked a little while ago about your book. Can I get a copy of your book?
Yeah, we're going to send it out to you. Anytime someone calls in, we send out a copy of Stem Cell and Platelet Therapy. Regenerate, don't operate.
Okay, well, you don't have my address, so okay.
Oh, we're going to get in touch with you. Don't worry. We'll find everything out. Oh. Great show, everybody. Thank you all. Time to move on. Nita, take it from there.
Thank you. Thank you so much. Thank you, Alex. Thank you, Suzette. Everybody who listened and participated, remember to join us next time and listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valance. Thanks for listening. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.